what is the Y-strap. And what the Y-strap is essentially is a chiropractic adjustment where we're able to axially decompress and adjust the vertebrae in the spine. And the difference between a axial and a rotational adjustment is an axial adjustment is an adjustment where we adjust the vertebrae in a linear fashion as opposed to a rotation. So if any of you have ever been to the chiropractor before, you've probably had an adjustment where you lay face up on the table and your cervical vertebrae are rotated in an adjustment. What the Y-strap does is it adjusts these vertebrae in a vertical manner as opposed to a rotational adjustment. And we're just going to demonstrate here in the office real quickly what it looks like, and then some of the conditions that we're able to see get benefits from. So we would have the patient lay here on your back, face up please. And we're going to slide down just a little bit until your knees go off the table. That's perfect. A little bit further. Good. So the legs off the table here, this is kind of going to hold the patient in place when we do the linear pull, the traction mechanism. All right, then we're going to bring the chin to the chest. Good. There we go. The back. Good. That's good there. Good. All right. Then we're going to come back. Good. That's good. With the head, sorry. So we're going to place the pads directly on the occiput. So that's the base of the skull. Then we're going to slowly traction the head up, and then there's going to be a quick pull up and a release. Essentially what that's doing is, which is a little more difficult when you're trying to do a manual adjustment with the hands, releasing the occiput from the atlas and the axis here in the top part of the cervical spine. You can see all some of the sensitive nerves in this area. When this is dysfunctional, you start to see conditions like chronic headaches, neck pain, even conditions like vertigo, dizziness, TMJD, jaw dysfunction. If you can see here, and it doesn't really show the jaw, but right off to the side of the occiput, you have the jaw bones. And when this part of the skull starts to have restriction or dysfunctions, it can throw off the tracking of your TMJ joints and cause temporal mandibular joint dysfunction as well. Other conditions that seem to do well are neck pain, and in some cases mid and lower back pain. There'll be a release much further than the top of the cervical spine, around the shoulders or the mid-thoracic, and in some patients even they get adjustments in their lower back, which can relieve some tightness and stiffness, even lower back pain as well. So I hope that answers any questions you might have about the Y-strap adjustment in Raleigh, North Carolina.